This is a literature review on dental facial effects of radiotherapy on the pediatric population with retinoblastoma. So what is retinoblastoma? Retinoblastoma, a malignant tumor originating in the retina, is the most common intraocular cancer in pediatric patients. This cancer can impact ocular health, but also the overall development of dental facial structures due to its early presentation in children. The most common signs of retinoblastoma are leukocoria and strabismus. Leukocoria basically means white people and is the presenting sign in 60% of cases. It is an abnormally pupillary reflex, usually more prominent after pupillary dilation. The initial presentation is an alteration in the red reflex that unfortunately goes unnoticed, so the diagnosis is usually made in advanced stages and is associated with worse prognosis. The second most common early sign of retinoblastoma is strabismus, which is hypertropia and crossed eyes. Why is this topic important? Advancements in treatments have significantly improved the survival rates of retinoblastoma patients. However, there are long-term consequences of radiation therapy or radiotherapy on various aspects, including dental facial development. Radiotherapy can have alterations on the growth and development of dental facial structures, particularly in pediatric patients, due to its cytotoxic effects on rapidly dividing cells. Consequently, significant effects to the dental and maxillofacial components, including teeth, jaws, and related structures, manifest over time. These sequelae can result in functional, aesthetic, and psychosocial challenges for retinoblastoma survivors. Understanding these dental facial effects of retinoblastoma and exploring the management and rehabilitation approaches to mitigate these effects is essential for improving the overall quality of life and long-term health. For example, this is a case study of a 14-year-old female who received external beam radiotherapy along with enucleation of the left eye for treatment of retinoblastoma at 26 months of age. As you can see, cranial radiation delays growth due to its effect on pituitary function, particularly growth hormone deficiency. This patient presents with short stature, immature facies, prominent forehead, with midline depression, facial asymmetry with hypoplasia of midfacial structures on the left side, a smaller maxilla as compared to mandible, maxillary teeth is in crossbite with mandibular teeth, arch length tooth discrepancy in lower arch with severe crowding and rotations. The objective of this literature review is to investigate the dental facial effects of radiotherapy in young patients with retinoblastoma by referencing current research. In addition, we want to note management and rehabilitation of the dental facial abnormalities, highlighting orthodontic, surgical, and prosthetic approaches. In addition, we want to understand the changes of dental facial development due to retinoblastoma treatment to effectively resolve issues relating to the dental and skeletal relationship and facial appearance. For the methods, a literature search was conducted to identify peer-reviewed English language articles pertaining to the dental facial effects of radiotherapy in retinoblastoma patients, focusing on the pediatric population. It was conducted in PubMed to retrieve articles published from January 2003 to December 2023. The following combinations of keywords were used in the search strategy: retinoblastoma, radiotherapy, dental facial effects, pediatric, and related terms. The Boolean operators and OR were employed to refine the search results. A manual search was also conducted to identify potential articles from the reference list of relevant studies. Inclusion criteria included studies that investigated dental facial effects resulting from radiotherapy in pediatric population with retinoblastoma, studies about facial growth alterations, odontogenesis abnormalities, dental facial deformities, management of rehabilitation techniques for dental facial issues regarding retinoblastoma were also included. Exclusion criteria excluded studies focusing solely on the medical aspects of retinoblastoma genetics or unrelated topics. As for the results and discussion, the research is still ongoing and the research and discussion are in progress. This is the references thus far. Thank you.